Hi, this is Dr. Khashy. I'm back with the second episode of this election series podcast of Uniting Inquiry. I'm still with my friend and our esteemed political analyst, Karim Boulos. Karim.
Nice to be here again. Let's look at our part two of this five-part series. And but before we begin, we talked earlier in your previous assessment or look at Quebec Solidaire about how do you solve the big problem. But a separate question, I think, which might interest your viewers is, what have you seen, or what innovative ideas are out there to, let's say, overarch, regardless of political orientation? What innovative ideas are out there available to whoever wins the election to implement for Quebecers?
I think that's a great question because there are many merits into the system that's currently running. I'm not talking about a political system, but it's a waste to be blindsided by deficiencies and not see those strengths, because we have the ability to transfer those strengths and areas of high performance into the other areas. I don't know about innovation, so I'm going to stay away from that word because it has a technical, scientific connotation. I'm just going to simply say the great things that I've seen in the past 2.5 years as a leader practitioner in a community hospital. I'm the chief of radiology department at Lakeshore Hospital, and our hospital was declared red from the first. So there was a massive amount of work, and many great things happened despite the calamities of the pandemic. And one of them was that kind of, as opposed to the traditional and historic bureaucratic obstacles in expanding services, the ministry was very permissive of the things that we wanted. We said, we need this, we need this, we need this. And they said, all right, just fine, you can take it. And it was very surprising to me how quickly those investments just paid off by themselves. We asked for a nurse in our department so that we can offer in-house procedures more efficiently so that patients don't have to be transferred downtown. That investment paid off in probably 3 months. We stopped transferring so many patients. I think a great model to be maintained. Many great things from medicine came out of the pandemic. The telemedicine came out, and it's here to stay. I hope this idea or courage to say, all right, these people are running this hospital or this institution. They want something. Let's give it to them and see what they do with it.
So if I'm hearing you correctly, you're saying that the decentralized decision-making to allow people at the front lines who know the situation best should be at least given more, maybe not complete autonomy, but more decision-making capacity.
Yes, in a setting of trial and error. It shouldn't be free for all. We can't afford to give anyone everything, but making a case for something a little bit less complicated. This is a difference between a deliberate strategy when you go and propose 5-year plan, or an emergent strategy. We're going to do this. Let's do this for 6 months and we'll report back to you.
Interesting. Okay, I think that's an interesting segue into looking at our second of the 5 parties. We'll look at the Liberal Party, and the Liberal Party, traditionally one of Quebec's solid backbone party between the PQ and the Liberals. They've run the governments for the last 50 years in Quebec until this last term. And what we're hearing from Madame Anglade is, oh, CAQ, we're not the CAQ. We are doing things and we're not the CAQ, and the CAQ is to blame for everything, despite having had the Liberals in office and in power for decades, interspersed with the Parti Québécois. So my first question to you is, in that we are not the CAQ, is one thing that Liberals propose is increasing salaries for family doctors. Again, it's another to your first analogy of the marble. So we're adding money, increasing salaries. Would that be, what are the advantages, let's say? What are the advantages to us as taxpayers of increased family doctor salaries?
Okay, so here's a Socratic inquiry element. Does increasing the salary of a family doctor translate into increased coverage of primary care for the population? I think this is an assumption. This is not automatic. If you increase the family doctors, is this the family doctors that are not giving the service because they're underpaid? We understand that there are penalties for them, but is that the only reason? I think that's a cognitive fallacy.
So salaries are not, increasing salaries is not a good idea.
Well, it's not that it's not a good idea. It is not the fix for everything. We know that elite professionals, the way knowledge workers are categorized, are not only driven by money.
Mm-hmm.
There's a PERMA V framework from Martin Seligman from University of Pennsylvania. P, positive emotions. E, engagement. R, relationships. M, meaning. A, acknowledgement, and V, vitality. Money doesn't come anywhere. There's, you're above a certain level, money does not increase your happiness. So I would argue, as someone who's worked in the public system for 11 years, sometimes up to 16 hours a day, that I would sometimes say, take this work and take the money that's associated with it and leave me alone. Or I would have worked and saved 2 hours extra and say, I don't need to get paid for this because I find meaning. I find reward in this. Go ahead.
If we can say it another way, that so it's not so much increasing salaries, because maybe that's one dimension of what needs to be fixed for family doctors, but it's just that. It's one aspect of it and not the single magic bullet that fixes the problem.
Yeah, so that proposition or any similar propositions, going to come out. The inaccuracy or clarity is that they mistake the road for the destination.
Okay.
What is the destination? You want to increase primary care for the population. That is a problem that everybody agrees on. Mm-hmm. That is a proposition. Can anyone guarantee that this is going to happen? It would be my preference to say our party promises 50% more coverage during the first, let's say, 2 years for primary care for everyone in Quebec at any cost. We're going to try anything and everything, because that is the goal.
That's a bold statement to say. At any cost means what are we going to cut elsewhere? And in that same theme, the Liberals also propose $6 billion and 4,000 beds as a new injection, and that becomes the part. We pay the doctors more, throw money into the jar, right, or expand the size of the jar, yes. and then we'll add 4,000 beds. Coupled together, are these three pieces? Does that stand up better?
Well, I'd love to see $6 billion more, because I'm probably going to get a piece of it as a doctor in the system. My department is going to be richer. But again, yes, the jar is going to expand. What's going to shrink? There is a price. That $6 billion has to come from somewhere. And I think it would be more clear to know where that's money. But what's going to give? I think everybody should say, and what's going to give, is that something that people will allow to be compromised? Is that going to come out of the education pot, or the public transport pot, or the whatever pot there might be?
Now, I love this conversation, because I do look at all the various parts and parts of the platforms and parts of the budget as part of analyzing the situation. But from a purely healthcare perspective, and notwithstanding where the money is going to come from, is this a good idea? Is $6 billion and 4,000 new beds going to fix the problem?
Depends on where that $6 billion is spent. Okay. If you spend it on infrastructure, mm-hmm. the most important thing being electronic medical records and seamless communication, that's worth it, because it's going to pay in 10 years.
So the notion of expense versus investment.
Correct. But if you want to throw it at problems, it's a never-ending hole. So I think that is, again, this goes back to the Quebec Solidaire proposal of separation of healthcare from politics, like separation of state from, so which is, I think a government should be allowed to dare to invest, even if they cannot prove that it's going to come out in 4 years, because most innovations are not going to come out in 4 years.
Of course. I mean, nobody, the hydroelectric dams of Hydro-Quebec that are reaping, we're all as Quebecers reaping the rewards and the benefits of it, were decades of investments. And I think I see that. What about the 4,000 beds? As someone with aging parents, whose parents have spent the night in a hallway on a gurney. I like the idea of 4,000 beds.
Sure.
What do you say to that?
So beds don't treat people. If your father lies on the bed, he needs a nurse on the bedside. He needs a secretary to organize things. He needs a doctor to take care of him. So for every one bed that's injected, there's a minimum number of human resources that's going to be required to run that bed. If it's a simpler care bed, it's easier. If it's a neurosurgical bed, it's much more complicated. Okay. So the bed ties in the people. And one of the things that we don't have at the moment is enough human resources. We don't have enough nurses, we don't have enough doctors. So 4,000 beds, we will be only, at least we need 20,000 more people on it. Do we have that? Which begs the question, how do you recruit them? And we know it's not just about money. If we look at the conditions, if we look at the model of purpose and the value that one derives from their work, then it's a lot more complex. Just lowering the R-score requirement to get into a program doesn't fix the staffing problem on the beds. One last question for you, just to try to get your take on the whole notion of overtime. The Liberals are saying we should eliminate mandatory overtime. What do we do with that? How do we, if we don't have the manpower, we can't get nurses through the system, we can't get doctors recognized soon enough, right? And there's no overtime, right. What happens? Well, that's it. You just said it. It's beating a dead horse. You want to, who's going to cover the overtime? Now, eliminating overtime is a great proposition because it improves the situation of the working nurse. That's what everybody needs. But so that's a check. Absolutely. So that's mandatory overtime has the word mandatory in it. It's not democratic. Therefore, it is not. We can do better than that. Okay, so if you are any party that wins, if the CAQ wins, they can take a lesson out of this particular chapter of the Liberal platform. So looking at, and that's the unfortunate part that we see as well. We are not the other party. The Liberals have done it, the CAQ has done it. And so whoever wins this election would be wise to look at everyone's platform and speak to experts like yourself to try to tie in the better ideas and try to find a way to integrate them into the overall practice over the next 4 years, and ideally keep the distance between as we did with church and state. Why not keep the government and the healthcare sector separate to provide that care at a frontline service? Khashy, thank you again, as always, very enlightening. I think that the Liberals have their work cut out for them, but the light that you shed on their platform helps people understand what it is that the main challenges that we have to overcome and their ideas for them. So thank you for your information. Thank you. Always a pleasure. Thank you, Karim.